so great to be with you and to be a part of this momentous time in our history. This is an extraordinary time. It's a time when we must come together to do one of the most historic pieces of legislation that we've had before this country in a long, long time. We must, again, the word is must, bring down the high cost of healthcare insurance and expand the coverage of healthcare insurance so that every American can have a high quality of healthcare in an affordable way and in a way that they can have choice. And so we're gathered here today, and I commend the AARP. Certainly Mr. Mitchell, your state director, is to be applauded, and all of those with AARP, and of course our distinguished panelists, Dr. Payne, and we're just delighted to be here. Let me just say a few opening words about where we are and what we're trying to do, and quickly get to what we're really here for, and that is to hear from you. First of all, we have moved through Congress over the summer months 5 different bills. Let me reiterate that there has been no vote in the Congress of the United States on any specific bill. We are putting it together. 2 bills in the Senate on the Finance Committee as one, and the other coming through the Health Committee. That's 2 in the United States Senate. In the Congress, we have 3 bills moving. 1 coming from the Energy and Commerce Committee, the other coming from Ways and Means, and the other one coming from Education and Health Committee. And we're going to put those bills together and try to come up with a bill that we can present to the American people that will do four essential things. First of all, we want to bring down the high cost of healthcare insurance. Secondly, we want to make it available to the American people. Thirdly, we want to have some protections, consumer protections, that will help bring down the cost and make the insurance company treat the American people more fairly. And fourth, we're going to make sure it is what we call revenue neutral, which means we will pay for it and not add it to the already outlandish debt that is on the backs of our grandchildren and children today. That is simply the 4 things we're going to try to do. The way we're going to do it is by, number 1, setting up what we refer to as an exchange. This exchange will have in it a variety of different private health insurance plans so that you will have a choice. Nothing in what we are trying to do will eliminate choice or will take you. You like the insurance that you have, you like the doctor that you have, we want you to keep that. We want you to keep that. But here's the problem. 14,600 people yesterday don't have that insurance today that they like so much. Just like 14,600 today have that health care insurance that they love so much in the doctor, but tomorrow they won't have it because the cost is too high. Right now in my own congressional district, we have 147,000 people in my own district with no health care insurance. The issue is that even if you had any other kind of industry, imagine, any other business in which they were losing 14,600 customers every day, you think they'd be very upset and concerned. You think they'd be moving forward to try to get something to stop this damage, this loss, this erosion. But no, The insurance companies are fighting against that. So we must understand, come together on those things that we have in common. And that is the high cost of healthcare insurance. And then move to fix it. We will have that exchange. And now much has been made of what we call the public option. Let me explain to you quickly that the public option is not there to be a stepchild or a stepping stone to moving the government to take away and control healthcare. Nothing can be further from the truth. We want people to have choices, and we want the prices to come down. The public option is put into the exchange to bring about competition. Bring about competition for the other insurance companies so that the prices can come down. And secondly, to serve as a place where people who don't have insurance can go to get insurance. We have businesses, small businesses especially, that don't want to provide insurance because it's too high. And they're going out of business because of healthcare insurance. But there's one thing I found out with the automobile industry when we were trying to help them. The biggest cost of making the car wasn't the bolts, it wasn't steel, it wasn't anything going into the car, it was the health insurance because it's so high. So we want to bring that down. There's some areas that I want to bring to the table to help with that as well that's not there. And that is the high cost of medical liability insurance. I happen to believe that it's a mistake not to put that on the table as well. Because one of the primary reasons and primary problems we've got is a shortage of doctors. And the number one reason that young people use for not going into medicine now is a high cost of medical liability insurance. The doctors are leaving the profession because of the high cost of medical liability insurance. You get out of school, you go through all of that, and the internship, and 8 years of training that you must go, and then you're faced with your own bills of how you to pay to get through medical school. And then when you get out, you got to get $100,000, $150,000, $200,000 in insurance to go forward. Tort reform must be at the table. One of the other reasons it causes doctors to have defensive medicine. You go to the doctors, they send you through a series of tests that perhaps you don't need, but they do it to protect themselves. And so for all of these reasons, the cost, the defensive medicine, to help with the shortage of doctors to get more in, tort reform, medical liability should be at the table as well. It's not there now. So I want you to know going forward that this is a work in progress. And we're open. These forums are very important. I've not shied away from them, and I've had several, and will continue to do so. And let me assure you that what you say to me today, I will take into me. Because in the final analysis, the only way this will work is that we bring the American people along with us. And we can do it, and we must do it. Thank you very much.